what if the very idea of progress, of getting ahead is slipping away? And what if our fundamental rights are being redefined right before our eyes? You might have heard the headlines coming out of Florida. The Surgeon General there, Dr. Joseph Ladapo, just announced a plan to end all state vaccine mandates. That includes those for kids in schools. He even went so far as to liken these mandates to slavery in a really powerful speech.
Yeah, it's striking language. And this isn't just about standard childhood shots. Governor Ron DeSantis is framing it as a big move for medical freedom. He's even launching a new commission, the Make America Healthy Again Commission, to guide policy. But, this decision, it's already sparking some intense debate.
Right.
A lot of public health officials are warning about significant health risks, serious stuff.
Absolutely. So in this deep dive, we're going to unpack what's driving these, seismic shifts. Everything from individual health choices to our collective economic anxieties, even the future of American families. We're looking at what the sources you shared reveal about these complex, often conflicting visions for society, and really what it all means for you. So today, we're diving deep into the latest reports. We want to understand not just what's happening, but why it matters. We'll explore Florida's push for medical freedom, that growing pessimism about the American dream, and even a conservative vision for American families. We'll pull out the critical insights from the sources you've provided. Okay, so let's start right there in Florida, where a lot of this is really heating up. September 3rd, 2025. Dr. Ladapo makes this huge announcement, plans to end all state vaccine mandates. And like you said, this isn't just a minor tweak, is it? It's a pretty profound shift.
It really is. And Ladapo's language, his rhetoric on this, has been incredibly strong. He flat out called all vaccine mandates wrong. And then made that comparison to disdain and slavery. He said very passionately, your body is a gift from God. So he's framing this squarely as, parental rights, an ethical issue. His core argument seems to be that you can't have real informed consent if there's coercion from mandates.
Right, that coercion aspect.
For him, it's fundamental. Liberty first, basically.
And Governor DeSantis is clearly right there with him, strongly backing this whole initiative. He's calling it a pursuit of medical freedom, like you mentioned, and announced this Make America Healthy Again, MAHA Commission. Sounds like their goal is pretty clear. Scrap the mandates using rules, using legislation, whatever it takes. A full court press statewide.
Exactly. And what's truly significant here, historically speaking, is that if this goes all the way, Florida would be the very first state to eliminate such a broad range of vaccine requirements for kids. We're talking about requirements for things like measles, chickenpox, hepatitis B, polio, DTaP. The standard shots usually needed for school or daycare.
Wow. So not just one or two, but the whole slate.
Pretty much the whole standard slate. Yeah, long-standing stuff.
Okay, so as you'd probably guess, this kind of bold move hasn't gone unnoticed. There was immediate and pretty significant backlash, right?
Absolutely. Public health officials, Democratic lawmakers, they were quick to react, calling it reckless and dangerous, warning it could easily lead to outbreaks of diseases we thought we had under control.
And they have data to back that up.
Well, yeah, their concerns are rooted in some, frankly, troubling data points. Florida's already lagging nationally. For instance, only about 88.7% of kindergartners there were immunized for measles, mumps, rubella in 2025. Nationwide, it's over 92%. And what's also kind of stark is the rise in religious exemptions. For kids aged 5-17, they've climbed to 6.4% across Florida.
6.4%?
Yeah, and in some counties, it's way higher, up to 15%. That suggests a real shift away from routine vaccination for some families.
And this is critical. The state's own health department data show that cases for things like hepatitis A, whooping cough, and chickenpox were already on the rise in Florida. So this isn't just a theoretical what if, it's happening against a backdrop of increasing cases.
That's a key point. And when CNN's Jake Tapper asked Dr. Ladapo directly about this, with the risk of more outbreaks, on September 7th, Ladapo was explicit. He said his department did not do a data analysis on how many new cases might happen if they lift mandates.
They didn't analyze that.
No. He framed it differently. He said something like, do I need to analyze whether it's appropriate for parents to decide what goes into their children's bodies? I don't need to do an analysis on that. So, again, positioning it as a rights issue, not primarily a data-driven public health calculation.
It's also interesting to see where former President Trump stands on this. His position seems a bit more nuanced. He advised caution on mandates generally, but he did acknowledge some vaccines, like polio, are so amazing, so incredible. He even said, you have to be very careful when you say that some people don't have to be vaccinated. So it shows there isn't just one single view, even on the right.
That's true. And this whole debate, it definitely goes beyond Florida's borders. At the federal level, you've got HHS Secretary Robert F. Kennedy Jr. canceling, what, 22 mRNA vaccine development projects?
Yeah, the messenger RNA ones.
Right, citing issues with how well they protect against upper respiratory infections. But then, on the flip side, you have Democratic governors out west forming this West Coast Health Alliance.
Yeah.
They explicitly want to counter what they see as politicization from the federal level and create their own immunization guidelines. It just shows how divided things are.
Deeply divided. And it's probably important context for you, the listener, to understand Dr. Ladapo's background here. Our sources mention his history, questioning COVID-19 vaccine safety, promoting treatments maybe not fully proven, even facing allegations about altering studies. Knowing that background helps understand the foundation for these policy changes. It's not out of the blue. It fits a pattern.
It certainly provides context for his public health philosophy, yeah.
Okay, so these deep divisions over health choices, they almost seem to mirror this wider crack in how people feel about the country, especially about the American dream. Moving beyond just health policy, your sources paint a pretty pessimistic picture there, too.
They really do. There's this Wall Street Journal NORC poll, and the stats are, well, alarming. Only 25% of people think they have a good chance of improving their standard of living. That's a record low. The lowest since these surveys started way back in 1987.
Wow, since 87.
Yeah. And get this, over 75%, three-quarters of people lack confidence that the next generation will have a better life than their own. That's a huge loss of optimism.
That really says something about the national mood. And the core finding, you said, is nearly 70% believe the American dream itself, that whole idea of work hard, get ahead, either doesn't hold true anymore or maybe never did. Highest level in 15 years for that sentiment. It challenges something really fundamental to the American identity, doesn't it?
It absolutely does. And there are concrete factors people point to. Persistent financial strain from rising prices. That's still hitting 28% of people hard, same as when inflation was technically much higher. Plus, you've got tariffs, worries about the job market, rents and insurance going up, people still feeling the pinch from past inflation, savings rates down. It's a lot.
A perfect storm, almost.
Kind of. And what's fascinating politically is that this feeling, this perception that climbing the ladder is just too hard now, whether it's entirely accurate or not, it creates, as the source puts it, more favorable conditions for the growth of socialism and populism. The feeling itself becomes a political force.
So even if some of it is maybe fueled by, say, unreasonable expectations, like, hoping mortgage rates drop back to those crazy lows of 2020, 2021.
Right, which might not happen.
The overall feeling of being stuck, of stagnation, that's real and it's powerful.
Precisely. And reacting to these kinds of deep societal worries, especially about family formation and birth rates falling.
Right.
You have this prominent conservative group, the Heritage Foundation. They're known for Project 2025, that big policy blueprint,
Right.
proposing something really ambitious. They're calling it a Manhattan Project for more babies.
A Manhattan Project for babies. That's a name. What exactly are they proposing?
It's pretty sweeping. They want major changes to U.S. economic policy, all aimed at encouraging married heterosexual couples to have more kids. One big part is shifting childcare funding, moving money away from programs like Head Start.
Which helps low-income kids with early learning and health.
Exactly. And redirecting that money towards individual families. Specifically, the goal is to make it easier for one parent, implicitly the mother, to stay home and raise the children.
Huh. And they also want the president, presumably Trump, if elected, to issue executive orders, right, requiring policies to be judged on their impact on marriage and family.
That's the idea. Any policy or regulation proposed would have to be measured. Does it help or hurt marriage and family? And if a program scores poorly on that scale, it could get overhauled or just ended entirely. It's a very deliberate strategy to use federal power to shape family life towards a specific model.
And within that plan, there are some specific points that might rub some people, even some conservatives or libertarians, the wrong way.
Definitely. The sources mention specific planks to which libertarians will surely object. For example, the Heritage Plan expresses strong opposition to what they call extraordinary technical solutions. That includes things like egg freezing, IVF, surrogacy, even genetic screening. They frame these as creating custom lab-created babies on demand.
So a real preference for natural conception, traditional family structures.
Very much so. They see this historically low birth and marriage rates as a major problem, needing these kinds of systemic, policy-driven solutions, not just leaving it to individual tech choices.
Okay, so let's tie some of these threads back together. We've got this push for medical freedom in Florida, this broader societal anxiety, this conservative vision for families. How does this connect back to Governor DeSantis' agenda in Florida, particularly around accountability?
Right. Well, DeSantis isn't just stopping at ending mandates. He's also signaling a really strong push to hold COVID-19 mRNA vaccine makers accountable for alleged side effects. He actually plans to ask the Florida Supreme Court to impanel a statewide grand jury to investigate potential wrongdoing related to those vaccines.
A grand jury, wow.
Yeah. And Surgeon General Ladapo, in parallel, has announced this new Public Health Integrity Committee. It's made up of professors, researchers, doctors who have been known to vocally oppose the widely held scientific consensus on COVID-19 vaccines. So it formalizes a skeptical viewpoint within the state apparatus.
And this committee comes after Ladapo himself put out that analysis suggesting a higher risk of cardiac deaths in young men post-mRNA vaccine, right?
Yeah,
An analysis that got heavy criticism from other medical experts.
exactly. That analysis drew sharp criticism from medical experts as flawed. So you see this ongoing tension, the official state position versus the broader medical establishment view.
And this whole theme of individual choice versus state systems.
Yeah.
It's not just vaccines, is it? It's also playing out with Medicaid in Florida.
Big time. During the pandemic, because of a federal rule requiring continuous coverage during the public health emergency, or PHE, Florida's Medicaid rolls just swelled, grew by over 1.7 million people, and a big chunk of that, 575,000, were kids under 19.
And that actually had a positive side effect temporarily.
It did, yeah. Because more kids were covered continuously, Florida's uninsured rate for children actually dipped slightly, from 7.6% down to 7.3% in 2021, an unintended consequence of the emergency rules.
Okay, but now the emergency is ending, or has ended, and the challenge begins. That federal PHE expires. States like Florida have to go back to the old eligibility rules. And people are calling this the largest healthcare coverage transition event since, like, the Obamacare exchanges first opened. That sounds massive.
It is potentially massive. Millions could be affected nationwide, and Florida's a big part of that. And it's causing concern. 40 different Florida healthcare groups and advocacy organizations sent a letter to the DeSantis administration. They're asking them, basically, please publish your detailed plan for how you're going to handle this unwinding, and please use the full 12 months allowed to transition people smoothly.
To make sure people don't just fall through the cracks if they lose Medicaid, could get other coverage.
Exactly. Ensure seamless transitions. Now, the Florida Department of Children and Families, DCF, they said they have a plan, but they didn't commit to publishing it publicly, just asserted they're prepared. But the advocates are worried, especially since Florida's children are seen as some of the most at risk in the whole country to lose coverage during this unwinding.
So wrapping this all up, this deep dive really shows how these fundamental arguments about liberty, parental rights, government's role, even economic fairness, they're not abstract. They're playing out right now, shaping health policy, shaping our national mood. From your doctor's visit to the voting booth, this stuff directly impacts your life, your community's future.
It really does. And these stories, they highlight a critical challenge for all of us today, navigating this flood of information. Different groups look at the same facts, the same values, but through such different lenses. It really raises that big question. How do we, as a society, find that balance between individual freedom and collective well-being, especially when they seem to be pulling in opposite directions?
Yeah, that's the core tension, isn't it? So as Florida moves to redefine medical freedom, and as that American dream feels it may be further away for a lot of people, here's something to think about. What role does your trust play in all this? Your trust in institutions, whether it's medicine, government, even the statistics we hear. How does that trust shape your own choices and ultimately our shared path forward?